Hello everyone, welcome to this presentation. I would like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respect to the elders past and present. My name is Delphine Gilbert and I am a healthcare and community professional working at Eventide Home Rockhampton, Central Queensland Hospital and Health Service. I am passionate about improving the quality of life for older people in regional areas, and that's what inspired me to do this research project. The title of my project is Stakeholder Perspectives on Improving Access to Allied Health Professionals in a Regional Aged Care Facility. This work is being done as part of the CQHHS Research Ready program, thanking all the facilitators from CQHHS and all of the team members for your support and guidance. My project's guiding idea is captured in this tagline, Bridging Allied Health Gaps, Strengthening Regional Aged Care Through Stakeholder Voices. Actively listening to and addressing consumer feedback in aged care is essential to uphold residents' rights, autonomy, and dignity. Feedback and complaints are not merely about improving services, but about ensuring consumer voices are heard, respected, and acted upon. By placing consumer voices at the center of care, providers strengthen dignity, respect, and empowerment while driving continuous improvement to enhance access to allied health services and overall care outcomes. Allied health professionals, including physiotherapists, podiatrists, social workers, occupational therapists, speech pathologists, and dietitians, are not optional extras in aged care. They are essential for maintaining mobility and independence, preventing hospitalization, enhancing communication, supporting dignity, creating social connections, and supporting emotional well-being of residents. So why this project? After working closely with aged care residents in regional Queensland, I realized many of their support needs, especially access to allied health, remain unmet or delayed. These services are often only reactive, not preventative. I chose this topic to give voice to those directly affected, residents, families, frontline staff, and to bring their ideas into the conversation on equity and reform. In regional aged care facilities like ours in Rockhampton, timely access to these professionals remains a challenge. Through this project, I aim to bring the voices of residents, families, staffs, and managers into the conversation on how to improve this. Aged care facilities face multiple intersecting challenges in regional and remote areas: workforce shortages, recruitment issues, geographic isolation, and long travel times for visiting practitioners, funding constraints, limited understanding of the value of allied health within the residential aged care homes, limiting on-site allied health presence, irregular schedules that disrupt continuity of care. Little is known about the lived experiences and practical suggestions of those affected by these challenges in regional Queensland. As of 2023, the Australian Institute of Health and Welfare reported significant disparities in service access between metropolitan and regional aged care facilities. That's why localized, stakeholder-informed solutions are very crucial. Aged care reforms spotlight the need for integrated allied health in aged care. National aged care reforms and the 2025 updated quality standards highlight the urgent need for integrated allied health to improve care, reduce hospitalization, and support aging in place. Connection to strengthened aged care standards. Starting August 2025, Australia's aged care quality standards are being restructured under the Stronger Standards, Better Aged Care reform. There will be 7 strengthened aged care standards. Through this program, the Commission is changing how they assess the quality of aged care and services, building awareness and capability in the aged care sector, simplifying process and resources so they are consistent and easy to understand. Because aged care reform is underway nationally and person-centered, multidisciplinary care is no longer optional, it's essential. My project strongly supports Standard 1 by governing consumers and protecting their rights. It contributes to Standard 2 by showing how feedback can be used not just for compliance but as a driver of improvement. It strengthens Standard 3 by addressing gaps in allied health access, making care more holistic and multidisciplinary. The aim of my project is to explore stakeholder perspectives on how to improve access to allied health professionals in regional aged care settings. The objectives are identify barriers and challenges, capture stakeholder informed solutions, understand perceived barriers and enablers across stakeholder groups, identify practical strategies for improving access to allied health services, explore how improved access impacts residents' well-being and staff experience. It also aligns insights with CQHHS and CQ strategic priorities and national reforms. The research supports CQHHS priorities of rural access and workforce sustainability and CQU's commitment to regional health research. This project also aligns with National Safety and Quality Health Service standards, particularly Standard 1, Clinical Governance, Standard 2, Partnering with Consumers, Standard 5, Comprehensive Care, Standard 6, Team Communication, Standard 8, Early Intervention Strategy. All of this reinforces how stakeholder-informed solutions can directly support reform goals. Residents benefit most directly when allied health services are accessible. It supports mobility, helps manage chronic diseases, strengthens mental health, and improves quality of life. Importantly, it provides more holistic and consistent care, something residents and families often highlight as a gap. For frontline staff, better access to allied health professionals means smoother care coordination. It eases the burden on nurses and personal carers, reduces stresses and burnout, and allows more efficient and personalized daily care planning. From an organizational perspective, improved access strengthens compliance with the 2025 Strengthened Aged Care Quality Standards. It also helps managers allocate resources effectively and fosters integrated multidisciplinary service delivery, aligning with broader CQHHS priorities. This research uses a mixed methods design, allowing both numerical data and rich personal insights. The setting is Eventide Home Rockhampton, a publicly funded aged care facility within Central Queensland Hospital and Health Service. Our participants include four main groups: residents who are able to provide informed consent, family members or next of kin who play a vital role in ongoing care, facility staff, including nurses, assistants, operational staffs and managers, and allied health professionals, whose access and input are the focus of this study. Recruitment will be done using a combination of internal communication, posters with QR codes, and digital invitations. We have made sure the consent process is accessible and appropriate for older adults. Data collection involves two main tools: a survey that includes both Likert scale questions to quantify barriers and priorities, and open-ended questions to capture deeper context, and semi-structured interviews which will explore stakeholder experiences, access issues, and suggested strategies to improve allied health availability. Consent obtained using accessible forms. Residents must be cognitively able to consent. Qualitative data will be analyzed using Brown and Clark's thematic framework to map barriers, facilitators, and strategies across groups. Similarly, comparative synthesis to highlight common ground and tensions between stakeholders. Survey data will be analyzed descriptively. Brown and Clark's thematic framework is a widely recognized method for analyzing qualitative data, offering a structured yet flexible approach. It involves 6 steps: familiarization, coding, generating themes, reviewing themes, defining, naming themes, and writing up. This approach helps capture the voices of aged care residents and stakeholders, ensuring their perspectives are meaningfully represented. Descriptive survey analysis will highlight key patterns and trends, providing a quantitative snapshot to complement the qualitative themes. Together, these methods align with my project's aim to use both lived experiences and measurable insights to improve access to allied health in aged care. All ethical standards, including consent, confidentiality, and support during emotional discussions, have been planned in detail. Ethical considerations. Ethics approval will be sought from a Human Research Ethics Committee, and site-specific approval from the participating aged care facility will be required for the project to proceed. Older residents may have varying levels of capacity to provide consent. To support this, participant information sheets will be written in clear, accessible language, and family members or guardians may be involved in the consent process. Participation will be entirely voluntary and based on informed written consent. Confidentiality of all participants will be maintained. Measures will be implemented to ensure that individuals are not identifiable in the study's findings and that it is not apparent who has or has not participated. This is especially important in small regional communities where participants may be known to one another. The study will take into account power imbalances that may exist between staff and residents, as well as among different levels of staff. To reduce this risk, individual interviews will be used rather than focus groups. Where applicable, surveys will be administered by an independent person. Participation may result in emotional distress, particularly for residents and carers. The research team will have a distress management plan in place, allowing participants to pause or withdraw if needed. Support services and follow-up resources will be made available. If participants raise concerns about care or name specific individuals or cases, they will be addressed sensitively and with strict adherence to research ethics protocols. Any such information will be de-identified before analysis or reporting. Data will be stored securely on internal systems. No identifiable data will be reported. De-identified data may be returned for future ethical use. In developing this study, we have outlined clear inclusion and exclusion criteria to ensure the participants can meaningfully contribute to the research. Inclusion is open to residents with the cognitive capacity to consent, as well as their family members, facility staff, and local allied health professionals. These groups were selected to provide a 360-degree view of barriers and enablers to allied health access. We have excluded residents with significant cognitive impairment such as dementia, as they may be unable to provide informed consent. Similarly, temporary staff or those not consistently involved in resident care were excluded to maintain consistency and depth of experience in participant responses. Ensuring participants can communicate effectively, either in English or via an interpreter, was also important to preserve data quality and ethical standards. So what we hope to achieve for residents is better function, communication, emotional and physical care. For staff, streamlined collaborations and reduced stress. For services, findings will contribute to the evidence base for local policy and service planning, improved compliance and care outcomes. Anticipated outputs. Dissemination strategies include internal CQHHS reporting, academic conference presentation like this one, journal submission to the Australasian Journal on Aging, and stakeholder briefings to support translation into practice. Next step for this. finalize ethics approval, pilots test survey tools, begin recruitment and interviews, conduct thematic analysis and disseminate findings. I have also included some references here. So that's the conclusion. I would like to end this session with the thought: when we listen to those who live it, we learn how to lead it. Together, we can bridge the gaps. Thank you so much for your attention. I welcome any questions or feedback. I have attached my email here. Thank you for listening.